So I think one of the key takeaways I've found is that this is a high priority topic where we actually know very little. So we actually don't have any national data that can tell us about the prevalence of chronic pain in the labour market, how much of it's work related and how much of it is going into the workers' compensation system. So I think one of the key barriers at the moment is a lack of awareness about the scope of the problem, the magnitude of the problem, which I think once we once we create more awareness about the issue and the burden, is likely to lead to greater action to address it. So I believe that part of the initial actions is to create greater awareness. So to collect the data that enables us to understand the true scope of the problem. I think there are ways in which workplaces, workers' compensation agencies, and public health and healthcare providers need to work together to better build confidence in how to address chronic pain, to work on keeping people at work. So trying to address pain before it becomes a problem, which results in people having to leave the labour market. So trying to keep people at work rather than trying to return them to work once they've left. And I think the last thing is that chronic pain often develops in relation to a number of other factors as well. So it's usually comorbid with things like mental health conditions, sleep disorders, and so better identifying how these conditions work together and addressing them in a more comprehensive way is, I think, some of the ways we need to move forward.